Liebe Wolfram, guten Morgen, guten Abend für dich. Es freut mich, dich zu sehen. Hello, dear Masumi. Great to see you. My dearest John, it's wonderful that you are here. Erki, mon chéri, comme ça la va? No, comme ça va? So it's great to see you. And well, officially we have to begin. I am very happy to be with you today. This is our 25th online academic session, and it's our last online session from this year. And we have a great program with Mausumi, our new member, Mausumi Natalie Syamal from the States, from the United States. And then we have our dear friend, Yoichiro Sugiyama. Hello, Professor Yoichiro. It's great to see you. He's talking about effects of electrical stimulation therapy for artistic voice disorders, its theory and clinical applications. And then we have Andrea Campagnolo from Brazil talking about vocal health and lifestyle habits in professional theater actors. This is a pilot study. Then we have these three wonderful new members' presentations talking about their trajectory and their goals in the artistic voice being a CoMeT member. So we begin, dear friends, and I hope you enjoy this wonderful, wonderful session. Thank you for being with us today, 15th of November. Thank you. I want to tell some words now about our dear CoMeT member and dearest friend, Krzysztofiak Izdebski, all well known in the voice field in the world. Unfortunately, he left us physically, but as we know, we stay with him all our life. We are going to make a special tribute on our next online session. So please prepare if you have some pictures or you want to say something about your experience with our dear Chris. Collegium Medicorum Theatri is going to make this tribute to him next year. Rest in peace, dear Chris. We love you. Now, I am very honored to talk a little bit about the biography of our Mausumi Syamal from the United States of America. She is board certified otolaryngologist. She has a fellowship trained in laryngologist, and at the moment, she is director of the Philadelphia Voice and Airway Institute. Known for her research on tubeless apneic laryngeal surgery, and has performed over 1,100 laryngeal surgeries utilizing apneic techniques. Diverse academic background she has, and she is graduated with distinction from Duke University with a Bachelor of Science in Mechanical Engineering. She also earned a Master of Science in Engineering at the University of Michigan in Ann Arbor. She worked as a global project engineer also in General Motors Corporation. Wonderful, Mausumi. She worked and auditioned also for as a professional actress and singer in New York before going on to medical career. She is graduate of the Wayne State University School of Medicine, and her residence was at Henry Ford Health Systems in Detroit. She has a fellowship training in laryngology in voice and airway disorders at the Cleveland Clinic. She serves on the editorial board of 3 major otolaryngology journals, and she has made many lectures, both nationally and internationally, in our field of voice. She's fellow of the Triological Society, that it is the highest honor given to any otolaryngologist. She's a fellow also of the American Laryngological Association. She's fellow of the American College of Surgeons and members of the International Association of Phonosurgery. Now is our dear CoMeT member, and she belongs also to our dear friends, the Voice Foundation. Thank you. Let's see your video. Thank you, Mausumi.
Hello, everyone. My name is Mausumi Syamal, and I'll be speaking to you on the topic of rituals and trauma in treating artistic voice professionals. I have no financial disclosures. We'll start with an introduction, and then we'll talk about understanding trauma, the role of rituals in healing, integrating rituals in trauma treatment, and then conclude with some questions. I'll begin with a quote that says, "The artist is the voice of the people, but she is also the people." The link between voice and emotion is something that isn't just intuitive, but has been studied. Vocal parameters such as pitch, intensity, duration, and phonation type are modulated by emotional state and can be used to distinguish between different emotions. In 1996, Vance and Scherer demonstrated that professional actors' portrayals of 14 emotions could be reliably differentiated based on digital acoustic analysis. In 2014, a study found that acoustic correlates of emotional valence depend on the emotional family. And in 2015, Burkholz et al. Showed that phonation type significantly affects the perception of vocal emotions, especially fear, anger, and neutral states. Neuroimaging studies have shown that there are brain regions that are involved in processing emotional voices, and these are called localized emotional voice areas, or EVAs. These are located in the superior temporal gyrus, which respond more strongly to emotional prosody and are functionally connected to regions involved in emotion recognition, such as the inferior frontal gyrus. If we're looking at this study visually, the emotional voice area is depicted in the red or fuchsia colors, and the temporal voice area, which is depicted in blue, is seen adjacent to it. Emotional sounds are processed, however, within a much larger cortico-subcortical network, which include the auditory cortex, the voice area, and the amygdala as core regions. And this was elucidated by Grissendi et al. In 2019 that showed that the voice area and the amygdala are key nodes of the network. Vocal areas are where emotional valence modulations selectively responded to human vocalizations, but not to other environmental sounds. However, in contrast, emotional valence modulated responses to both human and environmental sounds in the right amygdala. So let's talk about art, suffering, and trauma. Art is a form of emotional expression. Authenticity in art often comes from lived experiences, which can include rituals and trauma that the performer has experienced. It's important to remember that our artistic voice professionals are those that have excelled in conveying authentic emotion from their voice. So when their voice is unwell, a wide range of emotion and trauma may surface. I'll share this quote from Vincent van Gogh with you. "Though I am often in the depths of misery, there is still calmness, pure harmony, and music inside of me." Literature indicates a relationship between trauma, especially childhood trauma and adversity, and voice in performing artists, with evidence suggesting both negative and positive impacts on the psychological well-being and the creative experience. This was studied in 2018 by Thompson and Jacques, And it was a cross-sectional study of 234 professional performing artists, and found that those with high levels of childhood adversity, greater than 4 adverse events, had more cumulative traumatic events, higher levels of anxiety and shame, were prone to greater fantasies, and had a more intense and transformational creative experiences in their lives, suggesting that trauma may influence both vulnerability and creative capacity in performers. However, it's important to note that in this study, they did not specifically measure voice disorders, but rather just psychological and creative outcomes in artists that rely on their voice. Trauma and chronic stress have been linked and are recognized as contributing factors for functional voice disorders. So when we talk about trauma in our patients, how common is trauma? Well, I studied this preliminarily in 3 days of clinic. All patients were given 2 different types of trauma screening questionnaires. One was the LEC5, which just asked about events that were traumatic. There was no cutoff to this survey, but it's rather implied individually. We assume that if somebody said that there was greater than 3 events that they had experienced, that this was significant and that they had had trauma in their life. We compared that with the PCL5, where there is a cutoff score. And if the score is between 31 to 33, that's indicative of probable post-traumatic stress disorder. We used a cutoff of 31. So in 2 days, we saw 28 patients and 71% tested positive for a psycho-emotional traumatic disorder. This statistic is much higher than the United States national average of 5%. We offered all these patients trauma support. Many of these patients reported a link between their trauma and the voice symptoms that they were experiencing. And some reported talking about the trauma immediately exacerbated or worsened their voice. And this just showed us that our patients could use the support and special consideration. So when you have a voice artist in your office, you want to make sure you're asking about both emotional and physical trauma. Touch upon performance anxiety, rejection trauma. We all know actors, singers face multiple rejections a day sometimes. Ask them if they're playing an emotionally demanding role that's requiring them to tap into dark trauma or parts of their past that they may find emotionally charged. Ask them about physical trauma, the rigorous schedule. Is the role requiring choking or combat or screaming? Was there a phonotraumatic event that they had? Were they performing while ill? Or are they going out and celebrating a little too much after performances? So let's talk about the role of rituals in healing and performance. The Cambridge Dictionary defines ritual as a way of doing something in which the same actions are done the same way every time. That may sound like a lot of surgeons or health professionals. A ritual may also be a fixed set of actions and words, especially part of a ceremony as well. So there's a great role for rituals in healing and performance. Studies show that rituals or engaging in ritualistic behavior can actually lower perceived and physiological anxiety. Longitudinal research during the Diwali festival found that the time invested in rituals was associated with social bonding and even better subjective perception of health, although they found that benefits plateaued when there was an obsessive or excessive ritual engagement. Rituals also exert a homeostatic function and help individuals manage unpredictability. And when they're embedded in biomedical procedures, they may also mediate placebo effects through neurobiological pathways. So it's important to ask our artists what rituals they're using, daily rituals such as warm-ups, diet, exercise, pre-performance rituals, post-performance rituals, tinctures, things they may be doing. It's always important to ask, what are your rituals? Anything new? Anything different? So let's do a quick case. We have a 31-year-old female professional singer. She has a history of vascular ectasias as well as a right thyroplasty. She reports a significant number of complaints, mainly some neck, tongue, hyoid, muscle pain and tension that's making singing very difficult for her. It's been present for 4 to 5 months and it's severe. Prior to this, she was 100% normal. The rituals that she engages in is that pre-performance, she always sings the difficult runs in the shower the day before. And then right before she goes on stage, she takes a tincture of lemon, honey, and warm water. The new ritual are these aggressive neck massages that she's been doing. And particularly in June, she said that after her neck massage, she noticed pulsatile tinnitus, tongue, hyoid, strap neck muscle pain that was extremely severe. She also has been noticing hemifacial spasms. When we look at her exam, we see signs consistent with reflux as well as her prior right superior laryngeal nerve paresis, status post thyroplasty. But we also notice some vague fullness in the right parapharyngeal space. For treatment, we started by eliminating her singing full voice in the shower the day before, just to preserve her voice. I had her eliminate the lemon from her pre-performance tincture ritual, so she still kept the shot of hot water and honey. And then I had her move the neck massages to post-performances if she really needed them and thought they were helping. I also went ahead and did extensive labs and got a CT neck. While I don't have the images from her scan, particularly up here, I was just informed that unfortunately they do see a carotid artery dissection that they think might be the cause of what is affecting this patient. So in this scenario, this patient's newly implemented ritual of aggressive neck massages and manipulation may have precipitated the changes to the carotid artery dissection. Integrating rituals and trauma into treatment is really something nice and easy that we can do. I try to combine my therapy that I'm implementing with the rituals that already exist for the patient. If a person is struggling with emotional trauma, I try to integrate emotional or behavioral therapy and suggest it. And then I try to just give some practical exercises, breathing, visualization, and grounding exercises to help them. I think we have time for one more case study. So 35-year-old male news broadcasting artist reports increasing difficulty with maintaining a clear voice during his broadcasts. He denies any physical or emotional trauma. He's on a low-acid diet. He also has a medical marijuana card that we notice. Otherwise, he's in very good health. His exam reveals the following. So I began by asking him, what are his hobbies and rituals? And found that he was vaping marijuana after his Wednesday broadcast. So we implemented a simple treatment plan where we had him do 6 weeks of swapping the vape for steam inhalations and swapping smoking for edibles. And you can see what a difference 6 weeks makes for this patient. Let's do one last case study. 43-year-old male singer reports that in his own words, I have discomfort and limited voice in the middle of his speaking and singing range. He reports there was an inciting traumatic event while he was a soccer coach, and he was reprimanding a boy that was bothering other girls in the class. This invoked a trauma response in him and left him feeling emotionally charged when he shouted for the boy to stop. The following day, his voice worsened gradually. He's tried rest and honey, but the voice remains persistently poor. So here we can see a phonotraumatic lesion, which was precipitated by an emotionally charged vocal event. And for him, our treatment is the ritual of surgery. So to summarize, emotions and voice are inextricably linked. The emotional voice area is in the superior temporal gyrus, but the amygdala is also key to processing emotional vocalizations. Trauma is often a common thread amongst our artists, and screening tools are available to help identify this for our patients. Rituals are a way for us to manage anxiety and unpredictability in the world. Addressing trauma and incorporating treatment and rituals are the key tools to treating the artistic professional voice. I want to thank you all for your attention. These are some of the references I referred to in my presentation. Thank you to the Collegium Medicorum Theatri and Dr. Chavez. I appreciate the opportunity to share on this topic. I'm happy to take questions if we have time. Otherwise, I provided my information. Feel free to shoot me a note if you want to learn more. Thank you again.
Thank you, dear Mausumi. This is a very interesting topic that we are going to discuss afterwards. Thank you. And I would like to say hello and welcome to Andrea Campagnolo, to our dear treasurer, Austin King, also to our wonderful CoMeT member, Kitty Verdolini, our dearest Liza Popale, and also we have Deborah with us. Thank you, Deborah, for being here from Greece. And of course, we have some special guests. I thank this special guest to be here with us, Dr. Lara, Carlos, Burak, and things. Thank you. So I shall read a short biography from Professor Yoichiro Sugiyama. He's a new member 2025 from Collegium Medicorum Theatri. He's professor at the Department of Otolaryngology, Head and Neck Surgery at the Saga University in the Faculty of Medicine in Japan. He is graduated from Kyoto Prefectural University of Medicine in 2001 and got a PhD at the Graduate School of Medical Science, also at Kyoto Prefectural University of Medicine in 2010. He studied at the University of Pittsburgh as a postdoctoral fellow from 2010 to 2011. He works at the moment in the Department of Otolaryngology, Head and Neck Surgery in Kyoto Prefectural University of Medicine from 2012. He was assistant professor from 2015 to 2017 and lecturer from 2017 to 2024. He worked as a professor in the Department of Otolaryngology, Head and Neck Surgery at Saga University Faculty of Medicine since 2024. He is a specialist in laryngology, and he majors in clinical and basic laryngology, particularly voice and swallowing disorders. His research interest is neuronal mechanisms underlying swallowing and vocalization based on electrophysiology. Thank you very much, Yoshiro, for this contribution. And now let's enjoy his video. Thank you.
I'm honored to have an opportunity to talk in this session. I'm going to talk about the effects of electrical stimulation therapy for autistic voice disorders, its theory, and clinical application. In an aging society, vocal and swallowing functions decline, and its decline may initially affect vocal function. In addition, age-related diseases such as stroke, neurodegenerative disease, and cancer can worsen the voice and swallowing function according to age. We should treat patients with vocal dysfunction and dysphagia caused by perseverance, such as vocal fold atrophy, vocal fold scar, a decreased sensitivity of the larynx, and weakness of the swallowing force, as well as age-related diseases, which may cause the severe dysphagia because of decreased swallowing elasticity and an increased pharyngeal residue. As we will discuss therapeutic strategies for voice disorders in this session. To begin with, I'd like to explain the mechanisms involved in voice production. The vocal folds consist of several layers, including the epithelium, superficial layer, the intermediate layer, the deep layer of the lamina propria, the vocal muscle. Together, these layers create three components: the cover, the transition, and the body. Notably, each layer of the lamina propria varies in thickness along the anterior-posterior axis. These variations may help excellent vocal fold vibration during singing and talking. To achieve excellent and impressive voice production, the laryngeal sound, the power source of the voice, and the shape of the vocal tract are critical factors. Adequate subglottic pressure is necessary for effective vocal fold vibration, leading to stable and efficient laryngeal sound. Additionally, optimizing the patency of the pharyngeal and supraglottic spaces can create sinus formant, enhancing resonance around 3 kHz. Here are the examples of the relationship between the characteristics of the voice and activities in the internal laryngeal muscles. There are variations in the thyroauricular muscle activity among falset, head voice, and chest voice. Additionally, the activity of the cricothyroid muscle is adjusted according to the gradual pitch shift during singing as well as talking. This slide shows the additional examples of how internal laryngeal muscles control voice production. The activities of the cricothyroid, lateral cricoarytenoid, and the vocal muscles increase in relation to the fundamental frequency of the laryngeal sound. Interestingly, the posterior cricoarytenoid muscle, which facilitates glottal dilation, contributes to vocal control in both the inspiratory and vocal phases. As a result, the intricate functions of each internal laryngeal muscle are critical for vocal control during singing and speaking. In addition to those, the activities of the external laryngeal muscles are also critical for control of vocalization. The position of the larynx is essential for the good condition of the vocal tract caused by balance of the contraction and relaxation of the external laryngeal muscles. The pharyngeal constrictor muscles, which contract the pharyngeal space during swallowing, can also help shape it and control the physiological properties of the vocal folds. This slide illustrates the primary vocal pathways. One pathway is the limbic pathway, This links to the anterior cingulate cortex to the laryngeal motor neurons in the medulla via periaqueductic ray in the midbrain. This pathway is responsible for producing emotional vocalizations. The second pathway is motor cortical spinal pathway, which connects the motor cortex to the laryngeal motor neurons, facilitating normal vocalization during conversation. The basic sensory pathway and feedback system for laryngeal sensation involves the transmission of the afferent information from the vocal hold vibration, airflow, subglottic pressure, and the position of the retinoids. This information is sent to the nucleus structures solitarius in the medulla. From there, it is relayed to the laryngeal motor neurons in the nucleus and videus, which play a crucial role in regulating vocal fold movement during vocalization. And I'd like to introduce a proposal for a novel approach using electrical stimulation therapy for voice disorders. And we provide various types of electrical stimulation therapy for swallowing disorders, including CNS and peripheral nerve stimulation. And recently, we have focused on the interferential current stimulation and to achieve non-nocive, effective sensory stimulation to the larynx. To begin with talking about the electrical stimulation therapy for vocal control, we initially show a new technique of swallowing rehabilitation therapy using interferential current stimulation. The interferential current stimulation is generated by 2 kHz sinusoidal high-frequency currents with slightly different frequency diagonally delivered across the larynx. This stimulation can stimulate sensory nerve to the larynx. Previous studies have reported that IFC therapy to the neck improves swallowing function for delayed swallowing initiation. We can use IFC stimulation therapy with a commercially available instrument, Gentle Stim, in Japan. This is a 60s male with severe dysphagia caused by post-brain hemorrhage. As shown in this movie, it took a long time to initiate pharyngeal swallowing. Every bolus was transferred into the pharynx. Please wait for a while. That's it. The IFC stimulation immediately improved the swallowing reflexibility and pharyngeal clearance. For those patients, we can apply IFC therapy in combination with traditional swallowing rehabilitation. I will show the concept of the IFC stimulation therapy to improve vocal control. Laryngeal sensory stimulation via IFC may affect vocal control via brainstem neuronal networks, as mentioned before. Thus, the sensory feedback system of the larynx modulates internal and probably the external laryngeal muscles during ongoing vocalization. This is the fundamental theoretical proposal for the effects of IFC stimulation during vocalization, based on an animal study. In this study, vocal motor output could be influenced by concurrent IFC stimulation during vocalization induced by the electrical stimulation of a periaqueductic ray, which can produce repetitive emotional calls. Based on these initial findings, we can propose that IFC stimulation has the potential to alter vocal control. There may be potential effects of IFC stimulation on the control of voice. IFC stimulation as lower intensity elicit laryngeal sensory stimulation, providing feedback on vocal formula. On the other hand, IFC stimulation at higher intensities may elicit sensory and motor responses in the larynx, providing sensory feedback and direct motor control of the laryngeal muscles. This is one example of clinical application of IFC stimulation for functional voice disorders. She had a hoarseness and hard to sing at higher pitch. Acoustic analysis also displayed she had insufficient glottal closure at higher pitch during singing. She was treated by vocal exercise for 2 months with simple-bodied vocal tract exercise and fluctuation by SLP. It was not effective, so we tried to use the IFC stimulation during vocalization. Her voice was immediately improved by the IFC stimulation. So we treated her using a vocal exercise with IFC stimulation for additional 2 months. After the therapy, her voice was improved. This is the other case of difficulty with vocal control. She had excessive contraction of the supraglottic space during vocalization. IFC stimulation showed an immediate response to vocal control. This is the other case showing IFC therapy for vocal dysfunction as well as swallowing difficulty. She had left laryngeal power stage, which was fixed by the therapeutic. However, her right vocal fold and laryngeal cavity are sometimes under control, resulting in hoarseness and swallowing difficulty. We performed general rehabilitation therapy to improve those functions, but they have not fully recovered. This slide shows the voice and swallowing condition before IFC stimulation therapy. Vocal fold vibration was weak during vocalization. And constriction of the pharyngeal muscles was also weak during swallowing. After IFC stimulation therapy, voice and swallowing function improved. Thus, we consider that IFC stimulation therapy may be an effective therapeutic approach for vocal and swallowing disorders. The neuronal mechanisms controlling vocalization require exploration for both theoretical understanding and the development of new technologies to enhance vocal control during speech and singing. Interpharyngeal current stimulation therapy may help enhance vocal control in individuals with vocal disorders as well as in singers. Thank you for your attention.
Thank you very much for such an interesting topic. Thank you very much, Yoichiro. We enjoy that very much. And as usual, we shall discuss and talk to you about this topic after our session in the live discussion. And now I would like to read a short bio from Andrea Maria Campagnolo. Andrea is a laryngologist based in Rio de Janeiro with a career dedicated to voice care, clinical practice, academic teaching, and scientific research. She is graduated in medicine from the Federal University of Rio Grande do Sul in 1999 and completed her residency in otolaryngology at the Hospital de Clínicas de Porto Alegre. She earned her PhD and completed a fellowship in otolaryngology at the University of Sao Paulo. With the mentorship of Dr. Domingos Tsuji, she has completed several international observational fellowships. She is an associate professor at the State University of Rio de Janeiro. She's an active member of professional societies, including the Brazilian Association of Otorhinolaryngology, the American Academy of Otolaryngology, Head and Neck Surgery, the American Bronchoesophageal Association, and proudly the Collegium Medicorum Theatri. Her research focuses on voice disorders, vocal fold pathologies, glottic insufficiency, and care of professional voice users. She has several publications in important medical journals, and her works on reflux was recognized with a Scientific Merit Award. Thank you very much, Andrea. Let's enjoy your video.
Hello, everyone. Dear CoMeT colleagues, it's a pleasure to be here with you today. My name is Andrea Campagnolo. I am a laryngologist from Brazil, and I have dedicated my career to caring for the artistic voice, especially singers and actors. Today, I will share with you the first finding of a pilot study conducted with a theater company in Rio de Janeiro. This is an initial phase with a small sample size, but I believe it already brings meaningful insights, and I will explain our next steps to expand it very soon. I would like to begin with a brief overview of the study. Our goal was to analyze how lifestyle habits such as hydration, caffeine consumption, stress levels, vocal cool-down routines, and symptoms of laryngeal-pharyngeal reflux are related to vocal symptoms in professional theater actors. This first stage includes 12 professional actors from the Djavan Assembly Theater Company, and we use a structured questionnaire to collect information about their routines and vocal health. I highlight once again, this is a pilot, and the purpose was to test the methodology and identify key factors to guide a larger study. Why we start with a pilot? Because actors are a very dynamic population with diverse routines and needed to ensure the questionnaire fits their reality and capture relevant variables. We are now waiting for participation, feedbacks from 4 additional music theater companies in Brazil. Once their responses are included, we expect to significantly increase our sample and strengthen the statistical power of the analysis. These first 12 actors are between 28 and 49 years old, with average of 38 years, and have 6 to 24 years of professional experience. They perform 4 shows per week, each lasting 2.5 to 3 hours, which is a considerable vocal load. This already shows how demanding the routine is and sets the stage for interpreting the results. Here we begin to see the main findings. 75% reported vocal fatigue. 58% hydrated poorly, less than 2 liters a day. 75% consumed 3 or more cups of coffee daily. 58% reported reflux symptoms. 58% rarely practiced vocal cool downs, and 33% had moderate stress levels. Even in a small sample, these patterns are strong and align with what we clinically observe in performers. Lifestyles have a direct role in vocal well-being, especially when performers' schedules are intense. Despite this small sample, some statistically significant associations were found. Poor hydration with vocal fatigue. High coffee intake with reflux. Stress increased fatigue, and lack of cool down, greater fatigue. These associations remain significant even with this small group, which suggests that behavior-based interventions may have a meaningful impact on vocal health for actors. One unexpected result was that actors who slept 7 hours or more showed higher reflux symptoms. At first, seems contradictory. But when we look at closer, the explanation makes sense. Most actors eat late after evening performance and lying down too soon after meals, which increase laryngeal, pharyngeal reflux symptoms. This highlights the importance of timing of food and circadian rhythm. Something also observed in classical singers in the literature. What does this mean for us clinicians and voice specialists? These findings reinforce concepts many of us already work with. Hydration keeps the mucosa healthy for vibration. Caffeine increases acid exposure and should be monitored. Stress management is essential for reducing laryngeal tension. And cool-down routines help the voice recover and reduce tissue stress. Even simple changes in awareness and habits can reduce fatigue and improve performance quality. In future research phase, we aim to integrate subjective and objective measures, because performance-related voice evaluation must combine data plus artistic perception to reflect the reality of theatrical vocal demands. Our next step will include implementing a preventive vocal health program for these actors, combine vocal education, lifestyles modification, technique training, stress management, and multidisciplinary follow-up. This is very aligned with CoMeT philosophy, integrating medicine, voice pedagogy, and the artistic dimension of performance. To conclude, even in a pilot sample, the associations between lifestyles habits and vocal symptoms in actors were clear. This reinforces the importance of the holistic and preventive approach to vocal care in theater. As the next step, we will expand the study to include 4 additional theater companies and integrate multidimensional voice assessment to strengthen the findings. I hope this first insight encourages more research and collaboration in the area of theatrical voice care. Thank you very much for your attention and for this opportunity to share our early results with the CoMeT community. I look forward to exchanging ideas, learning from your experience, and expanding this research through international collaboration.
Thank you very much, Andrea. I also want to say hello to our dear CoMeT member, Lionel Lejeune. And we have some other guests, some friends like Alicia, Conrado, Monica, Sandra, Laura. Thank you very much. And now our part is, as tradition in Collegium Medicorum Theatri, we are going to show the self-presentation videos of our new members. Now we begin with the self-presentation of Mausumi. Let's see the video. Thank you, Mausumi.
Hi, everyone. My name is Mausumi Syamal, and I'd like to start by thanking the Collegium Medicorum Theatri for providing me the opportunity to take a few minutes to introduce myself. I'd also like to thank Dr. Chavez, and I'd like to thank my nominating mentors, Dr. Benninger and Dr. Sadala, for their support. I'll begin by sharing that I have no financial disclosures. I began professionally acting and singing and dancing as early as the early 1990s, but my parents will say it was probably closer to 1982 when I was performing shows in their jacuzzi. I was the child of 2 mechanical engineers, both my mother and my father, and so unsurprisingly, I studied mechanical engineering at Duke University. I liked it so much that I went on to study mechanical engineering as a master's at the University of Michigan, focusing particularly on biological heat transfer and biological fluid flow. I often like to think of the larynx as fluid flow in a tube with vibration. And so I'm able to use a lot of the principles that I learned about in my master's. And I find that really amazing because I draw upon my engineering background quite frequently. I then went on to work at General Motors Corporation, and while I was working at GM, I was also auditioning as an actor and a singer in LA and New York. I was lucky enough in May 2005 to land a small part as a supporting cast member in a well-known musical on Broadway. I was only there a few months, but it left a very large impact on me and allowed me to truly understand what it means like to work and have your livelihood depend on being a performer and how much the voice affects our day-to-day lives. This experience was one of the most profoundly eye-opening experiences, and I think really allows me to connect with my patients on a deeper level. I left after a few months because I was about to start medical school. But what I'll share for you next is a sample of my vocal audition that I used during that time. Make a wardrobe, you cut it down, then you'll never know. To paint with all the colors of the wind. You can only all your own. The colors of the wind. Following medical school, I went on to complete a residency in otolaryngology at Henry Ford Health Systems in Detroit and a fellowship at the Cleveland Clinic in laryngology, voice and airway disorders. After graduating from training, I worked for a private practice as a private laryngologist and then went on to work for a larger hybrid academic hospital system for 6 years before a brief small stint in Chicago as the director of laryngology, and then on to my current position as the current director and owner of the Philadelphia Voice and Airway Institute. I have 3 great areas of interest. One is apneic laryngeal surgeries, meaning surgeries done without any tube in place. 2, the effect of emotional trauma on laryngeal disorders. And 3, ethical and ecological impact of voice artificial intelligence. 3 interesting areas that are very diverse, but the thing that I take the most pride in is my trilogical thesis looking at the safety and efficacy comparing ventilation techniques for laryngeal surgery, which found that apneic laryngeal techniques are safe and effective. I thank you all for your attention today, and I look forward to working with you.
Thanks a lot, Mausumi. Let's see the self-presentation of Andrea Maria.
Hello, everyone. My name is Andrea Campagnolo, and it's a pleasure to briefly share my professional journey with you. I am a laryngologist from Brazil, dedicated to clinical care, research, and education in the field of voice. I completed my medical degree at Federal University of Rio Grande do Sul, followed by my residence at Hospital de Clínicas of Porto Alegre, and later a PhD in otorhinolaryngology and fellowship in laryngology at University of São Paulo. I often say that my journey in laryngology began with an inspiring encounter. I met Dr. Domingos Tsuji, who became my PhD mentor and later my fellowship supervisor. What started as an academic opportunity soon became a true passion for studying the voice. His guidance showed me the beauty, complexity, and impact of laryngology, especially when caring for those who depend on their voice as they are their communication and their identity. Along my training, I had the privilege of completing several international fellowships observer that enrich my clinical and surgical perspective. These include the Mayo Clinic in Rochester, the UCSF Voice and Swallow Center in San Francisco, the UCSF Division of Facial Plastic and Reconstructive Surgery, the Polyclinic des Minguettes in Lyon, Massachusetts General Hospital, and the Cleveland Clinic. Currently, I serve as an associate professor at the State University of Rio de Janeiro, where I teach, supervise residents, and work to integrate scientific knowledge with compassionate and evidence-based clinical care. I also a member of professional societies such as Brazilian Association of Otorhinolaryngology, the American Academy of Otorhinolaryngology Head and Neck Surgery, the American Bronchoesophagological Association, and proudly the Collegium Medicorum Theatri. Regarding my research, my focus has been on voice disorders, vocal fold pathology, glottal insufficiency, and care of professional voice users. I have published in journals such as Lung and Journal of Voice, including studies on neurogenic cough, PET injection for vocal fold insufficiency, and vocal emergency in performance. Clinically, I am deeply committed to caring for professional voice users, singers, actors, teachers, and anyone for whom the voice is essential. Over the years, I have developed experience, particularly in glottic insufficiency treatments, phonosurgery, and the aging voice. I also believe education should reach beyond academic walls. I am actively involved in public communication through Instagram and YouTube, bringing information about vocal health to a broader audience because awareness and prevention can change lives. Being part of CoMeT represents an opportunity that goes far beyond professional exchange. For me, CoMeT is a community that blends science, art, culture, empathy, and the human essence of voice. I am grateful and honored to learn and share knowledge with such inspiring colleagues, and I look forward to contributing to this community with openness, collaboration, and heart. Thank you very much for the opportunity to introduce myself. It will be a pleasure to connect and learn from all of you.
Thank you very much, Andrea. And now we enjoy the self-presentation of Yoichiro Sugiyama. Thank you, Yoichiro.
I appreciate that I can join as a member of the CoMeT. I am Yoichiro Sugiyama, an otolaryngologist from Saga University in Japan. I would like to provide a brief introduction. I graduated from Kyoto Prefecture University of Medicine in 2001. I have been working at University Hospital of Kyoto Prefecture University of Medicine, and I have studied at the University of Pittsburgh as a research associate. I have worked at Kyoto Prefecture University of Medicine for a long time. Then I moved to Saga University in 2024. I am now working at a University Hospital of Saga University. The Saga Prefecture is located in the southwest of Japan. Balloon Festival is one of the great festivals in Saga, where many tourists arrive at Saga to see balloons. This is a university hospital. The entrance wall features wooden-like structures inspired by Saga Nishiki, a specialty fabric from Saga. My specialty is treatment of voice, swallowing, and airway disorders, such as laryngomicrosurgery, swallowing surgery, and airway surgeries. Also, my research interests are primarily in neural mechanisms underlying vocalization, swallowing, and breathing. and neural control of vocalization due to laryngeal electrical stimulation is one of my topics. This is in the neural recordings in the brain. In my lab, this is one of my research interests. I focuses my research on the integration of laryngeal feed functions, which includes voice, swallowing, and respiration. Additionally, I am to explore innovative approaches for treating voice disorders through electrical stimulation therapy and antioxidant therapy. Thank you for your attention.
Thank you very much, Yoichiro, for your self-introduction. And now we keep on with our program. I congratulate all the CoMeT family, as always. Our CoMeT family is growing, and we are very proud of the 56 years of founding CoMeT in Mexico City. So we are one of the first associations with a specialization in artistic voice that had the world, and we keep on growing. Thank you. The next one. And now I shall emphasize some interesting matters. Please do remember that our members' work is published in our YouTube page for everybody, and they are so interesting and so original and so historical presentations, like, for example, Singing and Science, presented by Professor Dr. Jürgen Wendler, our dear honorary member, with many of our CoMeT members talking about different issues of science and art, mainly singing voice. And we had the permission due to our dear Harmschütte. And also we have the history of our friends, the Union of European Phoniatricians, also made by Professor Jürgen Wendler, but also a very interesting interview about glottoplasty, when the Association of Transsexual was made, I'm sorry for the name, was made by Marcus Hess, Professor Wendler, and some other colleagues. But also we have the Voice Foundation presentations, of course, with permission of the speakers, and also CoMeT virtual meeting. So enjoy all the presentations, because you have many dear friends, many icons from laryngology, phoniatrics, and of course, artistic voice. Next one, please. So I shall let you know some of the pictures from this wonderful presentation that I have seen so many times, and everybody's singing and everybody is wonderful. Enjoy that. It's really worth. The next one, please. And now we talk about our paper and our presentation of Collegium Medicorum Theatri in the world. As we know, one of our main proposals is to exchange knowledge and ideas among our members in the form of seminars and meetings at international conventions, and to facilitate the referral of a singer or actor to a well-qualified specialist in another city where the artist is scheduled to perform. So this is very important, as we know, because we are an international experts association in artistic voice. And to disseminate scientific and clinical knowledge about artistic voice among all other professionals, of course, singers, actors, and as we know, CoMeT is open in the different presentation and of course in our channel YouTube, because you have the opportunity to hear the experience and knowledge of this wonderful CoMeT family. Next one, please. CoMeT organizes also their own specific congresses. Perhaps next year we shall be with Katrin Neumann in Münster, Germany. And of course, everybody is invited to hear the CoMeT members as speakers. Sometimes there are special guests, but in general, our CoMeT congresses are to hear the CoMeT members' speakers. A member who is willing, not yet, please, the last one. A member who is willing to organize a CoMeT Congress needs to submit his proposal to the board at our next General Assembly. In case of several proposals, the General Assembly makes a choice. The program from this Congress has to be elaborated in accordance with the wishes of the President. Such congresses are open to the whole voice community and artist community. That means when in Münster we are going to have the annual conference with Professor Katrin Neumann in Germany, then everybody can come to hear the CoMeT specialist. And we have also a very nice proposal for 28 in Oporto, Portugal, by our dear CoMeT member, Pedro Pestana. But we shall talk about that in our General Assembly. Further, the CoMeT members are encouraged to give lectures dealing with artistic voice at other congresses and to do so under the CoMeT banner, because we are a CoMeT family with the authorization and, of course, all the procedure of the abstract from the president. Next one, please. And I will also remind you, in the Article 5 of our bylaws, the members must attend 1 out of every 3 successive annual meetings to maintain an active status. It doesn't mind that the members are retired, because we do appreciate the great experience and the accumulation of knowledge that the retired members have. Failure to comply with this regulation will result in their automatic relegation to an inactive status. That means the CoMeT members never end to be CoMeT member, but they come to inactive status. It's very important to be active. And of course, we sometimes do not have many things to say, but to be present in these online sessions is important. And of course, if you are inactive status, you lose the right to vote unless you are excused by ill health. All members have equally duties and rights, except that new members are nominated by fellows only, and that inactive members have no right to vote. Please try to read the bylaws, because in 2 weeks, we are having the General Assembly for the CoMeT, for the active CoMeT members. And of course, we have to remind you in Article 3 that our resources for the association, Collegium Medicorum Theatri, they come from the membership fees, very, very few from donations and subsides, some from proceeds from events and legacies and other benefits. So we do thank you very much if you take care of your payment fee. And of course, it has to be the 3 last years. Thank you. The next one, please. And Article 7 has talked about the rights and obligation of the members, the fellow associate members, honorary fellows, associate members, and senior fellows. So all the fellow group, they are in charge of the votation. But the associates member can also give us a sympathy vote, not an official vote. The right to vote in the General Assembly, as well as the right to vote and stand for election, are only available to fellow senior and honorary fellows. Any member can present her or himself as CoMeT member after the approval of the president. That's why we are a CoMeT family. Next one, please. And I will tell you that as Isabel, our membership secretary, Isabel Garcia Lopez, has already asked you for the information that you want, it's personal, to be published in our webpage. You can send your photo, you can send your data, or you can tell us, no, I am not interested. And so it says only your name and your country and your condition. Next one, please. And I remind you that 29th of November is our General Assembly at the same time, 11 Mexico City time. And our congratulations for the new year is 13th of December. To make a toast, have your, if you want to show some slides or talk something about your traditions or your experiences in this wonderful year and what you have want next year, please save the date. I see you 29 November. General Assembly, we work very hard, and then 13 December, we celebrate another year. Next one, please. And then I make a General Assembly, and please, I shall send the link on time in order that you have your registration. If you have some problems for the payment of the fees, please contact Austin King, our dear treasurer. Next one, please. And of course, those New Year, this is a big celebration for CoMeT family, of course. Next one, please. And I want to say some announcements. The Voice Foundation, our dear brothers and sisters, are having, as usual, his 55 annual symposium from May 27 to May 31. So if you are interested, please contact the Voice Foundation. CoMeT's special session in the Voice Foundation will be on 2027. We are every 2 years with the Voice Foundation as we did this year. Next one, please. And a great opportunity to be in this CoMeT special session in this wonderful event, PIVOC, Pan-European Voice Conference 16 with Voice Istanbul. This is a great opportunity also to be as a speaker, as CoMeT member. Please send me if you are interested in participating in this special session in CoMeT. Of course, it's a big congress, and our dear friends from PIVOC and from Voice Istanbul are giving us kindly time for CoMeT session because they love us and we love them. And please send the proposals. And don't forget, it's March 25 to March 28 in the great city of Istanbul in Turkey. Thank you. The next one. And don't forget to subscribe to our YouTube channel. And if you want that some of your great topics or your presentations want to be uploaded in YouTube channel, please feel free to contact me and send me your material so we can arrange that. I think it's very important, not only for us, CoMeT family, but for the world, that we have until now almost 30 sessions and congresses, London, Tel Aviv, online, and this is quite a big information. So please feel free, and we need to keep working as CoMeT family. So I thank you very much, and I thank also our guest to be here in the in this 25th session. I thank you very much, and now we shall begin with our live discussion. In our live discussion, we are the next one, please. Only the videos, only the faces, sorry. And so I shall ask our first speaker, Mausumi, in her experience, what can she say about actor's voice? Because we are all the time singing, talking about singing voice. This is important, but let's hear a little bit about actor's voice. What do you think, Mausumi, of all these situation that you pointed in your presentation about, for example, smoking, about coffee, about eating habits, about screaming, because as we know, the sensibility and the emotions of the actors are also on the daily life, not only when they are on stage. So, Till, please.
Yes, thank you so much for that question. I think with actors, we have to be even more worried about connections with emotional trauma. There's acting methods such as the Meisner method or methods of total immersion that require these actors to physically embody the role even outside of performance times. So there's a lot of actors that
drop into their role, even when they're at home or even in their daily lives, to get a better sense of their character. And those voice professionals are even at greater risk for trauma, emotional related voice changes, but actual physical trauma, because they may be using the improper or abusive vocal habits outside of just the theater or outside of just the filming even. So I found that actors and trauma are connected beyond the scope of the role on stage often. The other voice professional I want to mention are our voiceover professionals that may be recording books or recording larger pieces of work that require them to emotionally connect to as well as tax their voice just beyond what would be considered a normal performance. So all very important professionals to keep in mind, but with actors especially, ask how they are decompressing beyond their role. Some may tell you, I'm never out of character. Well, then that makes me think that they're at greater risk of traumatizing emotionally as well as traumatizing physically. I hope that answers.
Yes, yes, thank you very much. And I would like to ask our CoMeT members, for example, Dr. Yoshiro, if you have some comment about the great presentation of what's happening with rituals and trauma. Yoshiro, are you there? Yes.
Yes, I'm here.
Yes.
Thank you for having an opportunity to talk in this session. It's a very pleasure for me to be here. Thank you. There.
Thank you very much, Yoshiro. I would like also to say about rituals. For example, in some countries, they are due to tradition, to herbal tradition, or due to some ideas, magical ideas, that some herbs, like for example ginger, or for example eucalyptus, or some others, can have a benefit in the voice. As we know, every year we have more and more conscience, and of course, scientific evidence and medical evidence that there are also some herbs that are not correct for the voice. Because, for example, in the case that you presented about marijuana vapors, as we know, marijuana, not in Mexico is forbidden as in other countries, but some other countries allow that. The problem that I have been seeing, and that it's already published, is that marijuana dries a lot the respiratory system. That means pharynx and, of course, also larynx. Also, the problem is that they change a little bit or a lot the neuromuscular control. So I would like to know, Mausumi, because in one of your cases you talk about that, and there are some magical opinions of some singers that say, if I don't make love, I cannot sing properly. If I don't eat my favorite drink like tequila or cognac or whiskey, I cannot sing. So, of course, there are individual things, but scientifically, physiologically, well, we do know that dryness of the larynx and mainly of the vocal folds is terrible for the singing. And we know since the great publications from Kitty Verdolini many years ago, and of course, all the air pollution that I have been talking about also some years, and of course, the articles from Finland that they were talking about humidity. So if we take some herbal preparations that are drying the vocal folds, it's terrible. So tell us about Mausumi.
So with that patient that I presented, you bring up such a great point that often there's a resistance or some magical thinking involved in this. And for any of us that are doctors, it's important we approach this type of thinking from a point of empathy, but also curiosity and with data. So whenever I meet somebody that is having some magical thinking, and this broadcaster had some magical thinking, he didn't want to give up his vape. I approach it saying curiously, well, I'm curious. Can we then play around with the timing of it? Can we change the timing? If you're so committed to this, can we half the amount? Or I approached it a little bit differently because when he said, well, I could play around with the timing, and I said, we can play around with the timing, but why don't I swap it with a different form? Or do this, humor me. For 6 weeks, just give it up. 6 weeks, we give it up, and we look at the larynx again. And if the larynx looks the same, you can say Dr. Syamal is full of bull honky and doesn't know what she's talking about, and you can go back to it. Or we can do these six weeks, and after these 6 weeks, if your larynx looks different, then let's re-explore how you want to still integrate this herb or tincture in your life. And with that gentleman, after 6 weeks, he saw such a big difference. He said, I had no idea. I don't even want to go back to it. So being mindful, because we always want to respect there's cultural elements, there's fear involved. If we come to the patient with curiosity, I'm curious, can we try this instead? I'm curious, can you just give me 6 weeks? I think it's a little bit easier to overcome the barrier of this magical thinking. But it's something that we're seeing a lot of, especially in today's society. People don't necessarily want to trust doctors right away.
Yes, yes. The thing is that we have to handle that with care, and of course, as we know, with the team of professionals that are in charge of the singer. But as we know, some professional singers and actors, they have their own ideas about that, or they think they have the idea correctly, and they say, well, I have been investigating, and for example, COVID vaccine I don't like, and I don't like this, and I do like the other one. So I think it's also a matter of confidence in the doctor, and of course, with the help of the vocal coach or the singing teacher or the production or the manager, because sometimes the manager has to be careful, for example, to give the nebulizer to the singer in order to avoid dryness and things like that happen. So this is a really interesting topic. I don't know, Yoshiro, Kitty, Andrea, and the other CoMeT members that are not yet there. Yes, Kitty, please say us.
Yeah, this is really interesting. Thank you so much for those comments, Dr. Syamal. Yeah, my background is in experimental psychology, but I took a whole bunch of courses in health psychology as well. And one of the topics has to do with self-efficacy. And so what you're talking about there partially links to self-efficacy. So in the past, if somebody was a smoker and said, I want to stop smoking, but they didn't stop smoking, we always concluded they didn't really want to. Self-efficacy theory says maybe they want to, but they feel that they can't. So it has to do with people's appraisal of whether they can engage in a behavior. And so give it up altogether. Well, I can't do that. Well, give it up for 6 weeks. Well, okay, I can do that. And so I often approach this with curiosity, but also with an exploratory sort of an approach. And I'll say, well, what do you think you could do comfortably? So, for example, sorority women, I've had a lot of them who go out on the weekends and they drink, 8, alcoholic beverages on a Saturday night. And I say, okay, do you think you could, for every alcoholic beverage, drink 2 glasses of water real quick? Oh, I could do that. And then that slows them down. First of all, it rehydrates them. But I know some people in my family are in addiction medicine. And they talk about how this is increasingly becoming a model for addiction medicine, the self-efficacy model. Instead of telling people what they can and can't do, asking them what they can do. Because once they've said they can, I've had so many patients quit smoking with this approach, where no, I don't want to, I love smoking. What do you think you could do? Oh, 10 a day, and then 5. Well, then 2. Well, oh, forget it. But so much of it has to do with self-efficacy. So thank you so much for that curiosity and that exploration.
Thank you. I'm so interested in collaborating with you on we'll talk offline, but yes, I'm very interested in this.
Yes, and now, Andrea, do you have some comments about your rituals in Brazil? Because you also have a tradition as Mexico in herbal medicine.
What I think is to complement the idea of the Mausumi, because I think there's a lot of anxiety associated with the rituals and the use like marijuana or smoke, because they need to relieve the anxiety. I think it's mainly in when they have the actors has a load, they have a lot of work when they are performing, and I think anxiety is the point, and sometimes they need help with this because
Yes.
and sometimes we need to figure out I'm sorry, was said, sometimes it's difficult just not allow they smoke or not use marijuana, and you need to see and try a process with them.
Thank you. And I would like to ask Austin. I don't see you, Austin, but this is problem of me, not of the technical. Austin, what is your experience and opinion about the topic from Mausumi in rituals and trauma? Austin, we don't hear you. Can you please unmute?
Can you hear me now?
Yes, perfect.
Okay. Well,
Perfect. Your lovely voice.
I would like to make one comment briefly about because I think it's important medically, about the carotid artery dissection that was presented. I've had one of those, and if you have a patient that has a history of trauma to the carotid artery, either by massage, which was in the patient presented, or my patient had a severe coughing attack, and they have severe pain, but they almost always also have a hypoglossal nerve paralysis on that side, which is sudden and, of course, causes changes in speech and potentially swallowing. And if you see that, you really need to think about carotid artery dissection in your differential, because those patients need to be placed on anticoagulation almost immediately.
Yes, in that patient, we were not able to discern if there was some early signs of dissection because she had no obvious previous, but all of her symptoms started almost immediately after that massage, which she thought was part of her ritual of being ready to perform. And she had lived with this for several months before she came to me. And just on an offhand, I was like, let me get that scan. Yeah. She actually has a contrast allergy, but I insisted we pre-medicate because I was something wasn't right. A young person, hemifacial spasms, tongue isn't moving right. She should be well. So what a find. But yeah, very serious find, and unfortunate that she had done this all because she wanted to help her ritual,
Yeah.
Thank you.
Thank you.
And I would like to ask Erki Bianco, dear Erki, if you want to make some comments, because sometimes that we were talking about some herbal preparates that are used by you, if you want to comment something about them, or Erki, where are you? I don't see you. Yes, Erky? Oh. Well,
Okay, now
are
you can
you
hear
there?
me.
Are you
Yes.
there, Erky?
Yes, can you hear me now?
Yes, okay.
Okay. Okay, so for opera singers, it's much less of those drugs problems. Very few of them. If you do with a popular musician, it's plenty, and it's very hard for them not to go on. But it's much worse than marijuana and than just cocaine. They have terrible drugs, and it's very hard for them to stop. Even if they want, the drug dealers push them to go on. So it's not the doctor who's going to stop this.
Yeah, thank you very much, Erky. And Ramon, do you have some comments about this topic? Because we are changing now to Yoichiro work. Has you some comments, Ramon? Oh, he has some technical problems, so next time. So I would like to ask Yoichiro from his wonderful presentation, because you pointed also vital stim. The application of the electrostimulation, do you make, oh, I see Erky now. Thank you, Erky. I didn't see you, but we heard you. Yoichiro, if you have the application of this equipment inside, or for example, I can imagine if you can make that in vellum or in tongue, or you just make that outside. Do you have
Yes.
something to share with us?
Yes, the electrical stimulation therapy can simulate laryngeal space and the pharynx to stimulate sensory nerve, gently stimulate the sensory nerve to modulate swallowing functions as well and vocal function. So it's beneficial. It's available in Japan, but I'm not sure you can get some kind of electrical devices in your country, but
And do
I
you
think it's very
use?
precious.
Oh, it's great. Do you? I was not very clear if you are using only surface electrodes or are you using needles too? Or
No, just a
both?
surface electrode, very gentle. It just attaches the electrodes in the skin, the skin, but sensory stimulation was delivered into the larynx, So it's very
And for
yeah.
example, for pharynx and velum, do you use some anesthetica or some anesthesia,
No. It's
No?
very soft sensory stimulations. It's not painful. Just it's very useful and very easy to use.
And I don't know, somebody from the audience, if Mausumi, do you want to say something about that?
I was just going to say I'm about to sign off. There's a performing artist that needs to be seen, so I have to sign off. Thank you all so much.
Oh, thank you. I wanted your comment, Mausumi. Thank you. And what about Austin? What about your experience and what can you comment about very interesting and important Yoichiro presentation? Your macro, Austin. No? No micro? Yes, and Austin
Yeah,
wrote.
can you hear me?
Yes,
I'm
please.
on my phone and I just got a call from the hospital to see a patient, so I'm going to have to leave. And I texted everyone. These are very fabulous presentations, and which required a lot of work from the presenters. And personally, I appreciate them sharing that with us. And so I'm sorry, Eugenia, I'm going to have to sign
Don't
off
worry.
to go to the hospital.
Don't
But I
worry, my
look
dear.
forward to the General Assembly with everyone. Thank you so much.
Thank you. Thank you. And Yoichiro, thank you. Bye-bye, dear Austin. Kisses.
Bye-bye.
And Yoichiro, I wanted to also to ask you, because you were telling us that some of your patients didn't work properly, the usual vocal techniques that we use for swallowing or for voice recovery. But after that, you made a mixture of voice therapy and IFS. So can you please tell us about that? This is interesting.
Yes, we can do the voice therapy and swallowing therapy. In addition to the electrical therapy, it's beneficial for patients with people who is not recover using the voice therapy itself, but it's this additional therapy. Voice therapy is very useful to recover the vocal functions. Thank you.
Thank you. And have you have also some patients with this electrostimulation, patients with superior larynx, superior nerve paralysis?
A paralysis.
But
It's
superior, not inferior.
inferior, not superior. Yes, I think so, but I'm trying to do for patients with laryngeal paralysis or something. So
So
it's
you do
challenging.
you do think we have to take all the advantages from all the therapies? You think this
Yeah.
is the best as we know? Okay.
Yeah.
And what are your comments about vital steam? Because at the beginning of vital steam, we agree things, but with the experience, we know it's worth, but it is not solving all the problems. What is your experience?
Yeah, I have experience to use the vital steam, but gentle steam, the viruses are different. Vital steam can stimulate muscle contraction, but I've seen gentle steam can stimulate sensory nerve itself without muscle contraction. So that's the difference.
Do somebody from the audience want to ask something or to make some comment about this wonderful work? Andrea? Kitty? Erky? Yes, Kitty. You are mute.
Yeah.
Yeah.
Which of the works are you talking about? Are you talking about the stimulation stuff, or are you talking about in general? Which one are you asking about? Are you asking about the stimulation stuff?
Yes.
Okay. Yeah, one of the things that pops into my mind is, again, superior laryngeal nerve, as you were mentioning, Eugenia. I think we really underestimate problems with superior laryngeal nerve that affects both cricothyroid and sensation in the larynx. And so I was wondering what role stimulation might play for sensory functions. Maybe you already answered that, but I was distracted looking at the messages and what have you. And I asked that in a couple of senses. One is in spasmodic dysphonia, for example. One could conclude that spasmodic dysphonia is fundamentally an issue with sensory signals, because Christy Ledlow a long time ago showed that with repeated stimulation of the superior laryngeal nerve, normal people get habituation. That is, over repeated stimulation, the TA no longer responds. But people with spasmodic dysphonia with repeated stimulation of the superior laryngeal nerve, and presumably the sensory aspect of it, they don't habituate and they continue to get TA responses. And so one of my ways of thinking about adductory spasmodic dysphonia, and maybe it's all wrong, has been that it's as if the vocal folds have a rule. The vocal folds have a rule. If something touches you, spasm shut to protect the airway, unless what's touching you is the other vocal fold. How do I know that what's touching me is the other vocal fold? Well, if it's really fast, if it's 100 or 200 times a second, it's the other vocal fold. Otherwise, it's a crumb, and you need to spasm, to get the crumb out of there. And or I have increasingly become interested in the role of sensory functions in what is generally called primary muscle tension dysphonia. Marco Guzman and I argue elsewhere that we should get rid of that term, but sensory functions are implicated. And so I'm wondering, for the stimulation, does stimulation have any implications or utility for abnormal sensory functions that may underlie some, certainly spasmodic dysphonia, possibly primary MTD? I know that's a really long question and it's totally unclear.
Yes, Yoshiro?
Yeah, I think I agree with your ideas. For spasmodic dysphonia, this electrical therapy cannot work at all.
Right.
So,
Yeah, it would be the opposite. It would be the
yeah,
opposite.
opposite. Yeah.
Yeah.
So,
Yeah.
some kind of vocal dysphonia, we can use the sensory stimulation therapy, but some kind of dysphonia, we cannot do that. We cannot
So,
use it.
so I'm hearing that it may be more useful for paresis of the recurrent laryngeal nerve, but we have to
Yeah,
be careful about it for the superior laryngeal nerve
yeah,
because of the
yes,
implication for sensory functions.
yeah.
Yeah, yeah.
So it's
And
easier to,
Yoshiro,
yeah.
another question. Have you tried this electrostimulation by swallowing problems in children?
Yeah, swallowing problem. We can use it. We can use it very beneficial for patients with dysphagia, with decreased sensitivity of swallowing response and decreased contraction of pharyngeal contraction during swallowing as well. It's very useful for
And,
patients with dysphagia.
and for example, for babies, for
Yeah,
almost
we can use
newborns,
it. Yeah, we can use babies and every age. Uh, uh, yeah, we can use it for babies.
Yoichiro, and this equipment is available to, I mean, in the commercial world,
Yeah,
is
commercially
available?
available. Yeah, we
Uh-huh.
can get it commercially.
Andrea, do you want to comment something about the topic of Yoichiro?
No, thanks. Just very interesting study. I'd love to have this this equipment because I think it's really valuable, for who needs more stimulation. Because I think it's like I don't know if you can have the same with because the speech pathology here was things that stimulate for the larynx, during the sessions with speech pathology. They do that here. I don't know if it's a similar stimulation.
Thank you. And Erki, do you want to make some comment about your Yoshiro work? Thank you, Erki. So I think it's very interesting. I remember when I was in Berlin by Professor Wendler some years ago that we tried some stimulation that the Professor Seidner and Wendler they already made, and I tried that also in Mexico, of course, with the regular historical for the paralysis, and it was really, really very good, but only it worked in the moment that we make this stimulation. And now, Yoshiro, you are doing something different, and I think this is very interesting. Also, I agree with Kitty that we need to think about sensory problem and also stimulate with different kind of for example, for swallowing, with different odors and with different, how do you say, different tastes of food, because this is a sensorial problem also. Yes, Kitty?
Yeah, I was curious to go back to, and it might be a little bit off topic, but I see there's interest in the chat, to go back to the ritual issue and anxiety in performance. And a couple of comments there. First of all, most of us are probably familiar, I'm going to lower my hand here, familiar with, and I will share if I may, the Yerkes-Dodson curve of arousal and performance. So the Yerkes-Dodson curve from early 1900s is verified in thousands and thousands of studies for so many different tasks. That optimal performance actually comes with intermediate arousal. Low arousal gets you poor performance. High arousal, extremely high arousal gets you poor performance. But, there's a lot of discussion of how to minimize anxiety in performers, and rituals feed into the whole question of anxiety. But it's really interesting. A study was done by a sports psychologist several years ago. Her name is Debbie Cruz. And she looked at golfers who performed well under stress, under induced stress, stressful conditions, and those who performed poorly under induced stress conditions. And the thought was that the people who perform well under induced stress, perform well because they don't get anxious. Based on physiological measures and psychological measures, that was not the case. People who performed well and people who performed poorly had the same amount of increased stress. What was different was what they were doing mentally under performance. So the people who performed poorly under stress were giving themselves verbal biomechanical instructions covertly. The people who were performed well under stress had target awareness. So instead of focusing on their stress, or instead of trying to offset the stress by giving themselves biomechanical instructions, they had a visualization of where the ball needed to go. And so stress is not a bad, anxiety is not necessarily a bad thing at all for performance. What that research pointed out was what's important is what we do with that anxiety, because anxiety does not distinguish good and bad performers, which I think is really important.
Yeah, that's right. Thank you. And you know what? I was thinking, if you are so kind to share with my mail the different bibliography that you want to share with the CoMeT family, it would be great, and everybody can see that. Thank you. And back to Yoichiro now. I would like to ask Yoichiro, if you have, for example, I don't know if you have patients with artistic voice performers, but also with cancer in thyroid or neck problems, if you have had also some of these patients.
Fortunately, I have not.
Complicated cases, for example.
Yeah. I have some cases with complex cases, but it's challenging. So, unfortunately, I have no actual cases for patients with.
So it was wonderful, Yoichiro. And now, please don't leave, dear Andrea. I, in my population in Mexico City, as you know, we are one of the biggest cities in the world, and we have many actors. And myself, I was acting when I was a child and a teenager. And I do think that the actors in general, they have very bad habits, and they have another kind of personality as the singers. Of course, there are performers that are actors and singers at the same time, as we know. So, and I think that the actors, using their voices, they think that having a very how do you say, a low voice, like vocal fry or something. So you perform better when you are using your resonance in a low position, like chest voice. So what is your experience? Because you presented us a pilot study, but in general, what is your impression? Because you have been working a lot with actors, dear Andrea.
Well, I think what is important to them is to perform in their own register, because if they change, okay for exercise or things like that before, but during the performance, I think they have to use their own register, because if they are too low or too high, they can hurt the vocal folds, because the effort will be high. And they schedule in this during the season is very high, so I think that's why they perform better when they are in their own register.
Mhm. And what about the acting voice training? Because there are many techniques through the years, and they say this is the best technique for an actor's voice, and the other one is not so good, and things like that. I think this is a matter of education and training according to the situation of each actor. Not of course there are general rules in education of the actor's voice, but you cannot say, well, this technique is very good for everybody. I mean, in the voice, not
Right.
of course respiratory or posture or body movements. So I think I don't know what is your idea and your experience of technique in Brazil.
Oh, I think here I think I work with speech pathology. That's very training with actors and actors, and they use a lot of the tube, and they put the silicone tube, and they put inside like a bottle of water, and they keep making bubbles in the water. This is I think they use more and work very well, because it make the vocal folds strength with this kind of exercise. I think it's the most used here.
Thank you. So you mean semi-occluded vocal technique. This is good.
Right.
But I mean, for example, for resonance, are they
For
usually
resonance,
using? Yes.
and for resonance, yeah, I think it's good, and I think resonance with vibration, it's work very well too for the resonance. The vibrating the tongue, you vibrate the tongue. I think works well. And
Yes,
and yeah, I think the most here.
Yeah, I remember, for example, in United Kingdom, I'm sorry, Johnny is not here, but the style of the actors, classical actor, like in Shakespeare, or I don't know, Erky in Molière and other French authors. Which is your experience with the classical actor voice? Because even though there are wonderful techniques, like Kitty said, Lesac, and this is wonderful. What do you think, or what could you comment, Erky, about your experience in French
The big problem
theater?
now, it was the Royal Shakespeare Company had beautiful voice and using very well. The problem is to cure is not the singers, not the actors, it's the producers who make the actors and singers do crazy things. They even want to shout, they do crazy position, and they make them rehearse a lot, and they have no formation. They have no culture, they don't know anything about the voice, and they should be taught.
Yeah,
Right.
yeah,
I agree. Right.
This is right, and of course, I mean, our group is a multiple group of professionals. We have a lot of experience as CoMeT members in all this field, but I think we need to be very humble also, because there are many things that perhaps we do not understand how is everything happening in some persons. Like, for example, I want to make a special session of CoMeT with the efforts by rock singers, by classical actor theaters and things like that, to see what is happening with this. Because as Wendler said, well, science is very important, but many of the performers, they don't accept science. They don't accept teaching. They think they can do everything by themselves. And this is quite a situation. Yes, Kitty?
Right.
Mute. Micro.
Sorry about that. Okay,
Yes.
yeah. Yeah, and that's why I was referring to the Lesak work. The Lesak work, Lesak identified 3 body energies and 3 vocal energies, and then a social or a love energy. And you can combine these that affect the voice in different ways, that give you all kinds of different voice quality, all kinds of different vocal production mechanics. And you can combine them in any way that you want. You can do one of them, you can do any two, you can do any 3, you can do any 5. So you end up with a very large menu of options when you're acting. So Lesak is unique in that Lesak doesn't say there is one good way or healthy way or effective way to produce voice. He gives you a lot of options. And I've studied the Lesak work a lot, and I find them all to be healthy. And I also find that and these techniques, if you will, apply across, you were saying about, Shakespeare and the classical, theater, but they apply across all kinds of theater, from the most classical to the most contemporary. And when you're talking about, the directors may need education, I agree. But sometimes, good voice and speech people, I'll give an example. A director, this is what the Lesak masters do all the time. They're called into the theater because the director says, make this actor louder so that the actor can be heard in the last row. The Lesak people don't really make the actor louder. They improve the intelligibility, the articulation, so that the actor is understood. So the Lesak masters they're subversive. In other words, they listen to what the director wants, is asking for, and they find a way to get it in a way that's healthy and effective. And it might seem like tricking the director, but they are really, really good at that, which might be faster than educating a lot of directors. But I really find that the Lesak work is the most versatile. I really do. It's brilliant. It's brilliant stuff.
Yeah, I agree with you. Another thing that it is important in life, perhaps not in lifestyle, Andrea, but in the actor's voice, is where are they acting? Because as we know,
Right.
the production, as Erki says, can be made in a very difficult auditorium or stage or on the open air without very bad microphones and things like that. And that can, of course, harm the acting voice. And sometimes they have to make great efforts in order to place the voice properly for the audience. So which is your experience in this actor's voice problem? Andrea.
Yeah, you're right. The environment is very important, and sometimes they have, it's dirty, and they have allergy, and another thing that happens, associate with stress. They sometimes they have upper respiratory infections, and it can further challenge their vocal health, and they really need support from us.
Mm-hmm. And I was thinking also, Erki, in the problem of the production, because as Kitty said, sometimes the team, medical doctor, phoniatrician, laryngologist, acting coach, and the producers, they need to be together in order to see if this is possible. Because I agree, sometimes you can help the actors in order to use a proper voice and to fulfill the requirements of the director or of the acting situations. What can you say about that, Erki? Because sometimes I have been complaining with the director and explaining that it is not possible under difficult environment situation or stage that is not proper for example, a church or a cathedral without microphones. Is it not possible? So what is your experience, Eriki, about this complex situation of the acting voice?
Well, the problems they never ask medical advice or scientific advice. They think that's a new way of thinking. The Royal Shakespeare before, they were never shouting. There's not one play where they don't shout for every minute. So which was when we were a very, very bad actor, you start shouting to be sure you're good. But then now they ask the best ones to do it. And then there was a very good production in the Châtelet with something about a new Hamlet. But then the girl, she was the only girl on the production. And then she came last week because while she was doing with shouting in her voice, she ruined her voice. She couldn't be on stage for 2 more weeks after the production. So, but she didn't want to change.
Yeah, but I think with the modern situation of connection, we have been talking, I mean, all the community, not only CoMeT, but all the community has been talking and talking the necessity of being all together and to see which goals do we have with the actor in this case. And Yoichiro, are you there? Because I wanted to ask you your experience in Japan, but I don't see you in the list. Perhaps you are gone, Yoichiro. Oh.
I see him there.
Oh,
Yeah.
yes, you are here, Yoichiro. Yes, Yoichiro. What can you tell us? Because in Japanese theater, the situation is very interesting. Can you talk something about that, please?
I'm sorry, I can't hear that. So,
About the voice and productions and environments and of course the lifestyle of the actors, because we do know that discipline in the performing voice is very important.
yes, it's Japanese culture is it's kind of different, but um, I have I have some experience about the actors, but I have no apparent comment for that. I'm sorry.
No, but I think this is interesting in our group that we know many things, not only the production of the voice styles, but also the situation of how is the production in each country and how are the directors and how is the demanding, because as we know, Broadway is demanding too much, and here, for example, in Mexico, sometimes the stage is very, very dirty with dust and they use chemicals. And this problem with the smokes, they need to have smoke and everybody is coughing and the voice, thank you, is no voice of the singers. No, so in musical theater, this is a big problem. So, dear friends, I thank you very much for your comments. I don't know if you have another comment to do. I thank you for your time. And I thank you for these wonderful, wonderful feelings of sharing your knowledge and your experience. And thank you and welcome to the new members, Andrea, Yoichiro, and
Thank you
Mausumi.
very much.
Thank
Thank
you.
you.
And Kitty, it's wonderful to see you as always. I love
I
you.
love you too. So
Eri,
nice to see
I love
you.
you. Yoichiro, thank you very much. And many dear greetings.
Hello
And
again.
see you
Ciao,
in
Andrea.
General Assembly.
Hello.
All of you. Thank
Good to
you.
see you. Very
Bye-bye.
good.
Nice
And
to see
thank
you
you very
again.
much for all the
Bye.
guests that were with us. Alicia, Juan Antonio Lara, Laura, Rosa Maria. Thank you very much. And my dear Professor Wolfram Seidner, lieber Wolfram, thank you very much. Danke
Thank you.
vielmals. Tschüss. Bye.
Cheers.
Adios.
Bye.
Ciao.